If you were to say, here are 2 or 3 things that really they're low-hanging fruit, or there are things that if we work on it first, it's going to be so impactful to all the rest of the work that needs to be done. Mm-hmm. What's your advice about that to advocates who are like, where do I start with this?
Absolutely. And to go back to the rationale behind the framework, the question that we set out to answer, I think that's key to finding out what needs to be done. If we go back to that, the first thing we wanted to focus on was to make sure that we were promoting the child decision making. Very easy way to do that is to start designing, but also enforcing at state level, sex education curriculums that are there to be sensitive to the needs of the child and to promote their own decision making. An example of how that plays out already in some states is Connecticut's sexual health education curriculum is one of those really good best practice examples. Their curriculum is designed to give children the ability to identify threatening content online. That's a very easy, there's evidence on how to build that. So again, just implementing that education that promotes child decision making, step 1. Step 2 on how we can design a public health approach, which was that second sort of answer to our big question, is we need trauma-informed and accessible clinical services. So clinical services should be free for all survivors and victims. And also we can and should regularly train the people who work within them to be able to talk to the child, depending on their age, and to talk to a child that is at risk of being re-traumatized. And then the last thing I will say is, again, if we think of violence as something that happens in a broader environment, there's many risk factors that are common to other issues. We can design legislation that tackles broader social norms, that tackles broader social issues, and that limits violence in certain circles and has a ripple effect on child sexual abuse. So, for example, Vermont has had very innovative legislation around protecting their LGBTQ plus youth, which could also really help. So those are the 3 things I will say I would ask for advocates who are listening to maybe think about and push, although I know that lots of them are already doing it.